What's the role of beta blockers after MI in patients without heart failure? We know that beta blockers reduce the risk of mortality and new MI, but this is from data predating modern coronary reperfusion therapies, as well as secondary prevention, both of which have improved long-term outcomes. Beta blockers are particularly efficacious in MI and HFrEF and have properties as antiarrhythmics and antianginals. The BETAMI-DANBLOCK study from ESC 2025 sought to elucidate the role of beta blockers administered within 14 days of a myocardial infarction with an EF of at least 40%. The majority of these patients were treated with PCI, DAPT, and statins. Beta blockers were associated with a lower composite outcome of all-cause mortality, MI, unplanned coronary revascularization, ischemic stroke, heart failure, and malignant ventricular arrhythmias, which was mainly driven by lower rates of MI in the secondary analysis, with no statistically significant differences in the other, namely mortality. In the subgroup analysis, patients with STEMI favored beta blocker treatment, whereas there is no statistically significant difference in NSTEMI. Additionally, lower EFs trended towards beta blocker treatment, however, there is no significance that was reached. In conclusion, long-term beta blocker therapy reduced incidence of all-cause mortality or MACE in patients with MI and a mildly reduced or preserved EF.